Hi everyone, welcome to Movement Matters with three clinicians and a mic, where we're going to come to you with 3 degrees of perspective with physical therapy. Hi, my name is Jessie and I'm a doctor of physical therapy.
I'm Christiane and I'm a physical therapist assistant and I have a bachelor's degree in healthcare management.
And I'm Veronica and I am also a physical therapist assistant or PTA. And I have a bachelor's degree in health science and a master's degree in allied health teaching.
Awesome. Welcome everyone. So basically, we are here not only as clinicians, as we said in our little intro, but also friends. We've been friends for a little bit, so I think we should go around and kind of introduce everyone to who we are, a little bit of that.
Yep.
All right,
so basically we work together. We've been working together for nearly 10 years. We're 3 clinicians. We have the mic and we're here to share with you guys a little bit about our fields, a lot about the different types of things you get to see in our fields. I am a licensed physical therapist assistant for 25 years now. I have been doing this for a while, and recently I got my bachelor's degree in healthcare management, so that puts the perspective into this podcast. And then we have Vero.
So I am also, like I said, a PTA, a physical therapist assistant. I've been a PTA for going on 16 years now. I've worked in pediatrics, outpatients, skilled nursing facilities, acute care, all kinds of things. And, now I'm in education, and I feel like we felt it was important to share and help anybody out there that we can. Because we're passionate about it, we love it, and we think it would be helpful to just kind of hear our perspective.
Right.
Dr. Jessie, tell us a little bit about what, you're a doctor in physical therapy, so
yep.
Tell us
I graduated with my doctorate from FIU in Miami, Florida in 2010. I became licensed that same year and have been doing this since then. I've had many different job opportunities, from home health to outpatient to pediatrics. I've worked in skilled nursing facilities, and then of course I've been an educator since 2018, but with the ladies together since 2019. So that's kind of my background with physical therapy.
Yes.
Yeah.
So we're trying this out. We have we work as professors for the physical therapist assistant program here in Miramar, Florida. And we do get some questions, people join in and they want to know a little bit more about so many different things, right, Doc? We have pediatric conversation topics. So we have a bunch of stuff scheduled. So let's see how that goes. This is our first time.
Yeah.
So we are here to just introduce ourselves, get you guys to join us, send us questions. We are going to talk a little bit about more in terms of, the different degrees that we have in the physical therapy aspect of it, not just the bachelor's and the education, but also what is a PTA, right? What's the difference between doc and us? The length of time that it takes for you to become one here in the United States, the types of treatments, the types of jobs that are out there. So I think that's a good start,
right,
for the first day. We're going to be posting this, and we expect you guys to hit us up with questions, topics. We'd love to do this, maybe once a week. And if it becomes a little bit more popular, we'll come do
back
more. Right? So I think that I want to give the mic to Doc and say, Doc, how long is the DPT program, and what made you choose doctor in physical therapy as opposed to, for example, what we are, physical therapist assistants? Can you
that's a great question.
And tell us?
All right, so I love telling this story, but before I do get into how I got into physical therapy, first, I never even knew PTA existed. Oh, okay. So
that's a hot topic.
So for me, it was just physical therapy. And then when the time got closer to researching like what schools, I happened to be one of those years where it went from a master's to a doctorate. So I didn't have a choice to do a bachelor's or master's. I had to just do the doctorate. It's a DPT, so a doctorate in physical therapy. And for me, it took me about 7.5 years or so. At FIU, it was 9 consecutive semesters nonstop, the actual graduate program.
That's pretty heavy.
It was
But
heavy.
that's including the bachelor.
So 7.5 is including my, I have an associate's, a bachelor's in health science, and then the doctorate in physical therapy. Which, little side note, if anyone is into physical therapy and on the border of like what to do for their bachelor's, I actually recommend nowadays to go more the route of kinesiology versus the health sciences, because I believe that it's so heavy in kinesiology and anatomy that a lot of the times the health science kind of route doesn't really prepare you as deep for what's to come, and it does get intense.
No, I think I'm so glad you brought that up, because that might be some of the questions some of these people watching have. Hey, if I want to go to DPT, or even if I'm already a PTA, and I don't have a bachelor's because of PTA degree, and I'll ask Beto to share with us a little bit more about the PTA degree, but it is an associate degree. You still have to get a bachelor's. I think that's a great point, because schools often don't really tell you what kind of bachelor's to get. They'll say, get a bachelor's. It could be in anything. So you want to get ahead of the game, and you want to learn kinesiology, learn how to apply physics to the movements and all that cool stuff. So, and that was 7.5 years before you graduate.
Yeah.
So that's a nice lengthy time. And then the PTA program is only 2 years, right?
Approximately.
Yeah. So, Beto, you want to tell us how you got yours? Because you got a master's in education. Well, we don't know stuff about education. We hit up Beto. Like, help us.
Well, PTA wise, I did want to do something in healthcare, and I was like, I think I could be a doctor, be a nurse, but do I want to do that? Probably not. It wasn't my interest. I always liked the body. I always liked anatomy. And so I started looking at different options, and I was like, oh, physical therapy sounds great. And then my mother had physical therapy because she had a hip replacement. So I kind of started like hearing more about it, thinking more about it. And I was going to do DPT, right? I was like, that same thing. Like, you didn't really know PTA, DPT, or PT, whatever it was at that time. But I was like, do I want to, I only had an associate at the time, one of my associates. And then I was like, do I want to do the bachelor's and then go to DPT?
Do you want to go to 7.5 years?
Right. Then I had to do 2 years for the bachelor, 3 more years for the bachelor, then another 3 years of it. I was like, wow, that seems so long. And I had a child, and I went to work. And so I was like, oh, there's this thing, PTA. Maybe I could start there and then see where that goes, right? And then I could work in about 2 years and get in the field. So I applied for the PTA program, and then I just stayed a PTA.
I was about to say, this usually happens, because my situation is similar. I'm older as it is, and then having graduated in 2001, DPT wasn't a DPT; it was a bachelor's. But for me, the funny story is that I said same type of thing came up to PTA. So I think that we have a common thing here is nobody really knows what a PTA is. So maybe we can elaborate on that on the next, videos and stuff. But I was like, okay, there was a waiting list for me, right? So for physical therapy, same thing. I love to work out. I've done martial arts my whole life. And I said, okay, it was only a bachelor's degree, but it had a waiting list. So I was like, I don't want to sit here and do nothing for 3 years. So, here's an assistant degree. Let me go and do that first. And then what happened with me is as I'm graduating, it turned it into a master's degree. So it got a little bit further for me. And I was like, okay, I'm going to stay in the field, and then I'll go back. And then it's a doctoral degree. So I just said goodbye, kissed it. And I said, okay, I'll stay as a PTA. So I think that, the common sense here, the common grounds here is that in the beginning of this whole thing, nobody really know what an assistant was. And there was a lot of stigma to the word assistant. So maybe we can hit that up a little bit and explain. We do have licenses. We treat patients different than doc. We don't evaluate a patient. So we don't diagnose a patient. We need her to do that. That's why she went to all of those years further in school. And then we don't discharge the patient. So there's a few other things that we don't do as assistants. I often compare physician's assistants and physicians to physical therapist assistants and physical therapists because there's a lot out there in this. Other countries may not have it. Like in Brazil, I'm Brazilian. In Brazil, we don't have physical therapist assistant. It's either physical therapy or nothing.
Right.
So that was something new to me as well. And once I realized that with that small amount of time, with a lot of authority given by the license once you acquire that, I figured I don't want to go back and do it for many years. Not trying to convince everybody to not go. We need doctors, okay?
Right.
Please.
No, I don't regret it at all for one second.
You know what I mean? But the truth is that that's kind of what happened. And that's actually one of the reasons we wanted to do this today is to introduce ourselves and introduce a little bit about what a PTA is. There are so many people out there that think that an aide or a tech in physical therapy is the same, and that is not. Yeah. So, you might want to elaborate on that.
Yes. So sometimes people think that it's a on-the-job training type of thing where, like any assistant, like if you think of what is a personal assistant, right? Hey, you come here, do this. Hey, you come here, do that. Right. And that is not what a physical therapist assistant is, but it does have that word, that assistant word. But that's just like you said, a physician assistant has, and it's also not that. Right. That would be more like a tech or an aide, where it's on the job training. You help me get this, help me put this on, help me take this off, help me lift this patient. And they just kind of follow the rules. And of course, you can still learn a lot of clinical stuff and all that in that field, which is great. But you don't make some of the decisions about the patient. You maybe don't have as much of the background of what to do in an emergency or what to do if there's a medical situation, whereas the PTAs do because of their licensing. And that's why PTAs have that autonomy to be able to treat the patient and make those decisions about the patient, how to progress them, how to regress them, how are they doing, what is the scope of their pathology and things like that. So that's what makes it.
100%. And if you are watching and you are tech and you are a physical therapy aide, we're not putting you down. On the contrary, we love our techs. We're just trying to explain to the public that that particular part of the field doesn't require a licensure, doesn't require schooling. There might be some programs that are certification programs, much like a personal training sort of thing. But, and that's a great start if you just kind of want to feel what the field is like. But there's the actual clinician aspect, which is the first that we talked about, the PTA being the first degree, which is associate degree. And then, of course, having the DPT, which is a whole lot of levels above. There are some programs out there. They're called bridge programs. So if somebody's a PTA, if me at my age decided that I wanted to, join DOC and the DPT program, there are programs nowadays that bridge me from where I'm at to that DPT level. But, again, not everybody chooses to do that. And I think it's the cool part that we still have, a whole profession that is just on the assistant level, but we do get a lot done.
So how can we explain to our viewers, if they were interested, whether in PTA or DPT, how do they know that it's a good school for this career? Where can they go? Where can they find that information?
That's actually a really great point. We should actually put on the link below somewhere, wherever we're posting this, we can put some links. Vero, you want to take over that one?
I think the best place to start would be the CAPTE website. So CAPTE is the Commission of Accreditation of Physical Therapy Education.
Mouthful.
Yeah.
CAPTE.
It's easy. And it's CAPTEonline.org, I believe. But if you look CAPTE Physical Therapy, you'll find it.
We'll put the link on somewhere, whatever we post.
The actual accredited programs. So some, we've seen sometimes programs and stuff who are not accredited. Maybe they're in the process. Maybe, they're whatever they're doing. But in order to get licensed, at least in Florida, you do have to, and it does say in the laws that you have to graduate a CAPTE accredited program. There's no loopholes there. So if you go to a program and it's not accredited, you're going to do all that work and maybe learn a lot of great stuff, but then you're not going to be able to sit for the boards and get licensed. And again, we're coming from Florida, so you can only work in Florida if you are licensed and if you sit for the board. So it's good to find out which ones are accredited. It'll also give you information like if the program is on probation or something
Their
like
passage
that.
rates, like
Yeah.
how well
All
do
the
students
rates.
do afterwards.
And it is required in every school website that you post all your passage rates, all your licensure rates. So when in doubt, look for that information on whatever college website that you're considering because it is required to be there. And it shouldn't be too hard to find. One click or two, and you should find it as per CAPTIA requirement.
Right.
Yeah, and I think that's a great point because so much information out there, it's hard for us to disseminate what's good and what's bad. So if we can, in this first program that we're doing here for you guys, is kind of give you this background of, hey, here are 3 clinicians that have been doing this for an excess of 20 years, together 50 or more, right? And with that said, like make sure that you do your homework and you look for the right place because the last thing you want to do is graduate from a non-accredited school that has great marketing but never said that they were accredited. You never checked. And then you're going to go out there, try to sit for your boards, whether in Florida or any other part of the country, and you won't be able to because you won't be validated, your credits. And then you won't be able to take advantage of the last topic that we have for today, which is the jobs that are out there. Okay, let's talk about the jobs.
Yeah.
Starting with DPT. Honestly, if there was anything out there that made me go back to PT school, would be the jobs.
Yeah.
Because there are so many jobs.
I don't even know where they get our phone numbers, but I get random text messages at all times with recruiters offering me work that I literally have
bonuses,
to travel,
thousands of dollars
expenditures paid for. It's crazy.
I mean, it's beautiful. The work is hard. I mean, you heard her say in the beginning, 7.5 years that she devoted out of her life. That probably didn't go to the gym. The gym I did. Well, maybe the gym because it was physical therapy. But other than that, the movies are probably
no vacations,
no vacations, no social life. But the fruits that she's collecting, that she's picking up, to this day. I mean, if she decided to leave us, we're like, nah. But she'd be in a great position. She got a signing bonus somewhere, thousands of dollars. So many jobs out there, guys. PTs, DPTs. Tell us a little bit where they could get jobs.
Wow. Well, really, I always tell our students the sky's the limit. Really, at least in Florida, again, like you're putting your own boundaries of what you want. So you could own a clinic, you could own a facility. If you don't know how to start that up, you could buy a franchise of something that's already existing.
Yep.
You could work for home health agencies, meaning you're making your own hours and you're seeing patients in their home, so you don't have the overhead costs of an actual clinic or facility. You could work in what's called a skilled nursing facility. So there's a lot of work in that, typically for our elderly patients or geriatric population. You could work with pediatrics on the other side. So in pediatrics, we could work in the hospitals, right, in acute care settings for both geriatrics and pediatrics, actually, or just regular people who are there for surgeries or whatnot. And then you have like outpatient pediatrics and sports clinics and PPECs.
Yeah,
and you have so many.
Also, like positions of
so that's just like the clinical aspect, right? So then once that, we could go to the next level, which was what I was going to say is like you could be directors of rehab or clinical managers. And then if you're like, oh, I want to do research, we have a lot of positions in research now. You could do things if you're into like the political aspects. We have an organization that's called the APTA, American Physical Therapy Association, who advocates for our laws and stuff nationwide, not just for Florida, but every state has its chapter. And so you could work for them as well and really get into like what shape the laws of physical therapy around our states and country. And I mean, honestly, you're an author. You forgot to mention you're an author. You could write a book. You could create a class. You could make a podcast. I mean, you could go into education.
That is actually one of the things that we say because I'm, as you probably already noticed, just sitting here, I have ants in my pants. I put this up, I put this down, I'm moving, So I'm always moving around, right? Movement matters. Yeah. No pun intended. But the truth is that, when you are out in the field, you don't realize that there's so much you can do. Where, say, for example, and I'm just saying this because it popped up to my head, right? Surgical technology, right? Surgical technology is an amazing career. My daughter's a surgical technologist. She has only a couple of choices to work, right? She either can work in the OR and do surgery. She can be the coordinator of the surgery rooms, or she can be a teacher, right? So it's a very small range of what can be done. Whereas just you describing DPT, you went that whole range. I mean, you went from pediatrics to geriatrics, to sports, to research, to insurance, to home health. I mean, that's beautiful. You get tired of teaching, go back to treating. You get tired of treating. You hate people now, then go to insurance and deny their insurance. Or I don't know. So that's something that's cool. And then for PTAs, there's a lot of jobs too.
Oh yeah.
And in Florida, you can also get management positions. Like you want to look at Veto. Veto's our director of the program for the physical therapy that we work together. I'm the clinical director and I'm a PTA. So those things are super cool. You have to get your experience in the field. Please, newbies, don't think you're going to get out there and the first job is going to be a doctor, a director. But you know, so that's one of the things you say, I don't know how they got my phone number.
Yeah.
Let me tell you.
They get them.
And I'm like, oh, that looks like a good job. But I have a great job. I don't want to lose.
It's very tempting.
All right, we need more people to join the program to graduate and get the jobs because there's so many jobs. Okay. Freedom is a beautiful thing, and the fact that we can continuously learn. I was just telling Doc on the text message the other day, I asked the question, even though I've been doing this for maybe longer than they have, but it didn't matter. I'm always learning. She told me something, I was like, whoa, here I am learning 25 years down the line. Okay, so that's really cool. I'm not trying to sound cheesy. No. I am super excited about that. Yeah, there's always something to learn.
We're the perpetual students, though.
Yeah,
it may not be.
It may not be fair coming from us, from bias, but we will start getting some guests, right? If we do this right and we edit this right, and we're gonna get guests, and we're gonna ask people to shoot us any types of questions that they have. I think that it's exciting, and we can
super excited to share the information and just our knowledge with you guys to hopefully better you guys,
and just kind of give you that little maybe one of the things before we hang up before we finish that I wanted to point out is I'm worried about the future of the field, not just physical therapy, just all fields in general that require schooling. It seems like census are down everywhere, and it worries me because in the life, being that I'm the older of the peoples, I look at it and I'm like, what's going to happen in 20 years? Are we going to have doctors? Are we going to have people because it seems like people don't want to go through the process. There's not a lot of demand, and then it's like, there's demand of jobs, but not the people looking for the schooling. And I'm like, I'm scared, to be honest. So hopefully this podcast will trigger you to be like, you know what? She's right. It's only for PTA. It's only a 2-year program. For DPT is longer, but I'm young. I don't have a family. Let me go ahead and invest in myself, invest in the field. We love the fact that people can make money with social media. Who knows? Maybe we'll make money with this podcast, but that's not something that people should just rely on, right? From 20 years from now, like, what are you doing to help society, to help humanity? So that's how I feel about it. So hopefully this is what this will do.
Yeah.
What do you guys think?
Well, for me, I really want our viewers to understand the importance about movement. That I have a saying I tell the students all the time, that movement is life, and that's why we named it Movement Matters, because when we're not moving, something's wrong, right? And so in every aspect, from our joints, from our big toe, how that affects how we walk, right, all the way to our head, like everything. I want to try to cover as much as we can, from our development, right, from when we're inside our mother's womb and all the way to near death, right? Like there's so much that we could cover, and I really want to get that out there to you guys. So maybe it'll impact, you know, who knows, yourselves or a loved one or someone, or even in this career. So
I think that's great. What about you, Beto?
And I'll finalize with just saying, just look up or think or look at your favorite celebrity or whoever. I mean, almost everybody has gotten physical therapy at some point. It's just, you never know what happens, and everybody needs it. It's just one of those things where if you get hurt or if you stop moving, because movement is life,
or to prevent injuries,
or to prevent things, to improve things, you're gonna have to look at yourself and look at your body and think about how you can work with that and make sure you keep that quality of life and keep moving. And that is what we do as physical therapy practitioners. It's really about your own self and your own body and how we can just help you understand yourself better and move better.
Yeah, and then if that can help people stop taking so many drugs for pain, so many, you know, supplements for that are not really proven to work, but then movement works.
Yeah,
All right. So I think it's a good one for us to close. Yes. We want to say that movement matters. And we are three clinicians and